Have you seen? I'd imagine you get an influx of mental health issues as well. Would that be right? People, depression, and anxiety, and all those
Yes,
words.
yeah. It depends on the level. I don't get clinical depression where people really have to, that they wouldn't make it to the clinic. It's like, but I do get people who say, "Well, I'm feeling depressed," whatever that means to them, and a lot of stress and tension. And actually, this is a beautiful area for iridology. It normally tells me exactly where the person is with what's causing the tension. There are various signs which are 100% accurate. And then it will tell me what herbs they would need and what advice I should give them. But also it will tell me, it'll tell me how to take sort of, let's say, neuromuscular tension out, which is also causing headaches, which can also be causing high blood pressure. So you can do several things in one visit sometimes, yeah? They come to you because that they've got the tension, the nervous system is needy. But when you do the treatment, their blood pressure goes down and they feel more relaxed in their body. Yeah, so one simple thing like that can lead to a lot of other benefits in the body. Yeah, that's what I'm trying to say.
Yeah. So there was something that I mentioned before we started talking, and it was because I've been. So I'll give everyone some context. So a few months ago, I was doing some really deep thinking on sort of mental health, the mental health industry, and where it's leading, because there's more and more people are suffering from some kind of so-called mental illness these days, and it wasn't around. This wasn't around 60, 70 years ago. This was very unfamiliar. So I read quite a shocking statistic the other day. It was something like 62% of people aged 16 to 24 are experiencing symptoms of depression.
Wow.
Now I'm thinking, why is somebody that young depressed, or apparently depressed? So it got me thinking about all this thing, and the whole industry and I came to the conclusion that this can't be right. There's something not right here. No. So what I discovered is that the psychiatric industry, the mental health industry, what they will do is they will take normal human characteristics and then group them together and then create a label or a diagnosis, right? A disorder. Yeah. And then they will push it out onto social media and various other, ways of communicating with people. And now suddenly then, if you resonate with that characteristic, you've now got a disorder. You've got a mental health issue. Yeah. When actually it's just a natural, normal human characteristic. It's part of the human experience.
Exactly.
Is what I'm saying. Now, what I've been planning on doing is putting together a case and gaining evidence and everything else. And this morning, I've discovered that there's a man called Dr. James Davis. He's a PhD, psychiatry and all the rest of it. And he's done this very thing. He's done all the work that I was planning on doing. And it's on YouTube. And it's absolutely unbelievable what he talks about. I can't even put it into words. I was shocked. I don't know if you ever heard of the Diagnostic Statistical Manual of Mental Disorders, or the DSM for short. Have you ever heard of this?
I haven't. No.
Well, this is a manual that basically it's the Bible for psychiatry, right? Everybody in that area will use this book. Now, this book, to put it in simple terms, I'm conscious of the time, so I don't want to keep it too long. Yeah. And we'll do a separate video on this. But essentially, this book, it's been confirmed by the people who created it. And it's not based on scientific evidence. It's based on a voting system, a consensus. So every single mental disorder, or so-called mental disorder, is not actually based in scientific, biological evidence, empirical evidence. It's based on a consensus.
Goodness.
Now, that is shocking.
It is.
Can you believe that? So, and this is household mental illness, depression, anxiety, and all the rest of it. ADHD is another big one, very popular today for some reason.
Yeah.
This is not based in scientific evidence. This is based on a consensus of a very, very small group of people who create the manual.
Goodness me. Well, that's no.
So I just thought I'd mention that just to see if you ever heard of it before. Or
that doesn't seem to be. It doesn't seem to be useful, does it? Really? I mean, my teachers used to say to me. I've got two main teachers, Dr. Richard Schultz and Jill Rosemary Davis, wonderful herbalists from Norfolk, and they used to say to me, don't name an illness. Don't do what the doctors do. Just treat the person with what they're presenting and what they do. And then you've got a flow, and you just got to keep that flow going, and they end up the other side of the treatment, hopefully very, very well indeed. But you haven't cured an illness. You haven't named an illness and got rid of it. And also they used to say to me, and they used to remind us regularly about this, the doctor will say you've got this, and most people will keep that illness in their mind and body until the doctor says they haven't got it. If you see what I'm saying? They feel they've got their diabetes or whatever until the doctor says they haven't got it anymore. Which is,
it becomes an identity, doesn't it? They wear it because of who they are.
Yeah. And if you hang on to an identity, that's a good word for this we're talking about. If you hang on to an identity, it'll stay. That's it. What happens in the mind happens exactly reflected in the body. Yeah. Yeah. You know, every organ in your body.
I've got depression, or I've got anxiety. You know, it's like you're wearing the badge of honor in many ways. It's like, this is who I am. When in actual fact,
it must become part of who you perceive yourself to be. And you can hear people in general conversations saying the same thing. How are you? Well, he says that I've got this, or the doctor says I've got to take that. And, you know, you hear it all the time. Any social gathering, you hear it all the time. But the idea really is to, you know, every organ in your body has an influence on a certain train of thought. This is a part of what I was talking about earlier, metaphysical iridology. The liver, for instance, is the organ in which anger, frustration, and to some extent with some people, depression is seated. The kidneys are the seat of life energy. That's a Chinese medicine concept, which is accurate. That's where your main chi is seated. But more than that, the kidney energy gives you the motivity to move forward. The kidney energy is to do with fears, but not fears of spiders or anything like that. Fears of moving forward. And people who can't move forward often need their kidney chi raising a little bit. Do you know what? That's so easy to do with medicine, herbal medicine. It's so easy. And organs like the spleen and the lungs and the lymph system, they all hold different energies which collate with the mental images you have. That's why the two.
I mean, I suppose that's why then when you feel a certain emotion, you can feel it here.
Point to it. Yeah. You feel grief in the chest, in the lungs, and to some extent the heart. Spleen energy, that little organ, the spleen, which isn't, I don't think it's that well known in the West. The work I've done in Singapore tells me an awful lot more about the spleen than our doctors are trained to know. But it's mostly metaphysical stuff, not physical. That's why our doctors don't know about it. And, you know, it's complicated. And people whose spleen energy is down throw off with all sorts of health challenges, usually minor, so they're not seeking illness for those illnesses per se. But when we deal with the spleen energy, they feel better in all sorts of ways. It's really strange. It's a complicated organ metaphysically, very simple physically, but complicated metaphysically. And this level of dealing with patients is so rewarding both for the patients and for the practitioner. You know, it's like
and
look at the energy of this organ, and a light goes on. This needs picking up a little bit. Yeah, and it's good work to do at that level. It's lovely. Yeah.
Yeah, it goes because it's all linked, and so to link this to mental health,
Yeah.
and specifically depression. A lot of people what they say they're experiencing as depression is in fact coming from the chemicals that are in this section of the body here.
Yeah. Well,
What's the longest nerve in the body, I believe, is from the head to the gut or something, or I don't know if that's
the vagus
correct.
nerve, the 10th cranial nerve. Yeah, I think that's the longest. It's a long time ago since I did anatomy and physiology. There might be, not sure about. There might be. I think that's the longest. But it's the 10th cranial nerve, the vagus nerve. Very, very important. And there's a ring form in the eye of just about every single person, which is visible, which tells me about the autonomic side of the nervous system, to which the vagus nerve tends to have, various links. Sometimes these links between organs and nerves are a bit tenuous. Sometimes they're very, very important indeed. Again, I can't say this often enough. The eyes will tell us what's going on in that area. I mean, you talk about mental illness. We mentioned the spleen. Well, if the spleen energy is down, then it is really easy to raise up. If the spleen energy is down, do you know that person, and this is accurate, that person will tend to overthink things, not in a minor way, in a major way. So if we turn the spleen energy up, maybe they overthink things just a little bit less and their depression gets a bit less. Now, I don't know if there's any doctors could ever agree with that, with what they've been taught, but it happens in that way. Conversely, if the spleen energy is too high, that can have physical problems with, strangely enough, the digestive system. The digestive system and the spleen are very closely linked in Chinese medicine, but it's not a physical link, it's a metaphysical link. So you see, all these things are to be sorted out. When you're with a patient at my level, you have to just keep peeling the layers off the onion and revealing the base cause. And when you've got that base cause, then you've got something to work on and to help the patient with. Yeah, absolutely.
Yeah, because the chemicals, the brain is a concoction of chemicals.
Yeah.
Right. So what, and all food is chemicals.
Yeah.
And the guts and so everything else is chemicals. So it's all this stuff has an effect on how we think. Right, different chemicals in the body are going to have different reactions, and therefore cause different thoughts or whatever else.
It forces them. It doesn't give you a choice. It forces them. Forces these mental aberrations. And of course, again, being a little bit careful with words, some of the medical interventions that people have had over the last few years have chemicals in them that will pass the blood-brain barrier. And that barrier is what's protecting your brain, supposedly, against chemicals and other things. Yeah? You've got more parts of the brain that protect the brain than you have neurons. It's just a medical fact. And when you get these chemicals that pass the blood-brain barrier, I don't know, I'm not a scientist, I'm not a doctor, but I'm wondering if that is the cause of some of the tiredness and, I don't know, hormonal upsets with people. There's got to be a reason for all these things, this increase in things recently. Yeah. Food for thought.
Well, for sure.
Food for thought.
Food for thought, yeah. Listen, Alan, it's been absolutely fascinating to talk to you. And I could continue this conversation pretty much all afternoon, as I'm sure you could as well. But I know you're a busy man, you've got places to be. So I'll let you go.
Okay. Thank you.
So what we'll do is we will definitely pick this conversation up again when you've got some time. We'll talk, all the areas that we couldn't cover today.
Well, I think that
We'll do that very soon.
what we've done today felt a little bit convoluted to me, and we're dodging here and there in different subjects. So I'd really like, if you agree, to do some specifics like herbal medicine and
Yeah, of course.
different natural healing techniques, maybe give people a few hints, and iridology particularly. Let's see if we get any requests for that type of thing. I can do it at a very easy to understand level, Russ. Yeah.
Yeah, sure. Today we could call it an introduction to who you are, just talk generally. Now we can get into the real meat and potatoes of it all.
Excellent. That would be great. Thanks for asking me. Okay.
No, it's been a pleasure, and I think we need more people like yourself. We need more information like this out there. So let's do our bit to push it out for sure.
That's all we can do. Yeah.
Okay.
Thanks a lot.
Right, Adam, let's speak soon.
Yes, indeed.
Take care, everybody.
Bye-bye.